While elderly individuals who live in nursing homes may be susceptible to several types of abuse, one of the most insidious and intentional forms is financial abuse. Financial abuse in nursing homes involves the illegal, unauthorized, or improper use of an elder's money, benefits, belongings, property, or assets for the benefit of someone else. Financial abusers take advantage of someone's financial assets for their own gain, without the victim understanding the consequences or implications. Since elderly residents may have physical or mental conditions that limit their cognitive abilities, they may not recognize when someone takes advantage of them. If the elderly person doesn't have much support from others, they may be more vulnerable to financial abuse. Financial abuse of an elderly person can occur at any time, either in a nursing home or outside of it. Approximately 1 in 6 people aged 60 years and older experience some form of abuse in community settings. Cases of financial abuse were among the most common types of abuse, representing over 14% of all abuse cases. Over 90% of abusers are family members or other trusted individuals, such as primary caregivers. Those closest to the elderly individual often have knowledge of their finances and gain their trust in order to take financial advantage of them. In a slight variation of financial abuse, private companies may attempt to convince elderly people to purchase services they don't need, and then overcharge them. Common business schemes involve selling home improvement services or overpriced insurance. Financial abuse is profoundly serious. If enough money is stolen or misappropriated, the individual can be left unable to support themselves. There's a number of red flags that may indicate an elderly person is experiencing financial abuse. Unexplained changes in a bank account, unexplained withdrawal of large sums of money or securities, new or added names on an elder's bank signature card or brokerage accounts, unauthorized withdrawal using the elder's ATM card, sudden changes in a will or other financial documents, unexplained disappearance of valuable possessions, substandard care provided by staff or family members, unpaid bills despite adequate funds, discovery of an elder's forged signature for financial transactions or titles, the sudden appearance of previously uninvolved relatives claiming financial rights, unexplained transfer of assets to a family member or someone outside the family, an elder's fear and anxiety when finances are brought up, an elderly person signing strange financial documents they don't understand, nursing staff paying a highly unusual amount of attention to a resident's finances, missing money after nursing staff visit. The best strategy to prevent financial abuse is to have a team in place that prevents harm from occurring. This team should know the signs of financial abuse and keep close track of the residents' behaviors. Nursing homes should assemble their own teams that monitor patients and their caregivers to ensure that patients are not being financially abused. All team members should receive full training to understand the warning signs of financial abuse and be aware of who monitors the patient's finances. Staff should be alert to changes in the individual's financial status, including unpaid bills to the care facility. No form of abuse or neglect should be tolerated at nursing homes. Residents have the right to adequate and safe treatment. If suspicions arise concerning financial abuse, it's important to immediately document evidence. Make sure each instance is noted with the date, time, and what was observed, and contact information for any witnesses. If your loved one is unable to advocate for themselves, you can speak up on their behalf. The first step is to file a report with the nursing home facility. This should occur regardless of who you suspect to have engaged in financial abuse. Next, contact your local long-term care ombudsman program. Each state has an appointed ombudsman that works to resolve problems related to the health, safety, welfare, and rights of residents of nursing homes and other residential care communities. Then contact Adult Protective Services, a social service program provided by state or local governments nationwide. It serves older adults and adults with disabilities who are in need of assistance. APS team members collaborate closely with professionals to investigate cases of abuse, neglect, or exploitation. When a report of potential abuse is made to an Adult Protective Services agent, an APS agent will assess the adult's safety, need for assistance, and determine what services would be beneficial to maintain their well-being. Remember, financial exploitation is a crime. Contact your local law enforcement agency. If you suspect financial exploitation, reach out to your local law enforcement agency and report your concerns. You may also consider contacting a lawyer with experience in nursing home abuse. By knowing the warning signs of elder abuse, you can help keep vulnerable people safe. If you suspect nursing home abuse is affecting your loved one, or if you've experienced financial harm due to nursing home financial abuse, contact us for a free case evaluation. We listen to your concerns and help seniors receive the care they deserve. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.